Good evening. I'm Dr. Shah. I'm one of the clinicians here. Can you confirm your name and age, please?
Uh, I'm Maria Smith and I'm 45.
How may I address you?
Miss Smith is fine.
Okay. Now, from your case notes, I can see that you had a mild heart attack 2 weeks ago.
Yeah, doctor. It was very dreadful experience. Yeah.
I know how difficult it can be to have a heart attack, and
Yeah.
especially the time after that. So, do you have any specific concerns for the day?
Doctor, it has been 2 weeks now, and I still feel weak and get tired. So yeah, I mean, I'm really very much now frightened that doing any activity may, because of that, it may come back.
I know it's frustrating.
Yeah.
But let me assure you that after a heart attack, it is absolutely fine to have some weakness and tiredness for about 4 to 6 weeks.
Oh.
That happens mainly because the heart is still in the recovery phase, and that may make you feel very tired because the heart cannot actually cope with the physical activity that you do.
Oh.
But let me reassure you that it's not as serious as you think. The things will improve if you take the medications regularly, and apart from that, if you incorporate exercises, so slowly and gradually your strength will improve.
Okay. But doctor, doing any activity, I mean, I'm really scared that it may, welcome another heart attack. So, is it okay, or how much activity should I do? Please tell me.
That's a really good question.
Yeah.
Now, there are two aspects of resuming your physical activities.
Mhm.
The first one is because it has been already 15 days since you had a heart attack, and from your files I can see that you did not have any complication after that, fortunately.
Mhm.
So this is right time for you to slowly and gradually start your routine activities.
Okay.
And there is try not to rush things. Try to go slow. If you feel tired, exhausted, feel free to take rest for a while, and then again resume your activities. How
Okay.
does that sound?
Yeah, that's fine.
And apart from that, I would strongly recommend that you join a cardiac rehabilitation program. Do you know what is that?
No, what's that?
So as the name suggests, it is mainly for patients who are kind of recovering after a heart attack.
Okay.
In this program, physiotherapist is the head of the program,
Mhm.
and patients joining this program will be doing exercises under the supervision of a physiotherapist.
Okay. That, yeah.
And the physiotherapist would actually, make a customized plan for you, so that depending on your strengths and depending on your capacity,
Mhm.
you can. They will be suggesting you how much exercise is good for you.
Okay, that sounds great.
And if anything goes wrong, like you say that you are worried of doing physical activity, so if you are joining the rehab program, if anything goes wrong, the life-saving tools are readily available.
Oh.
So things can be managed fairly easily if you are doing exercises under supervision.
Okay.
Would you like to join one?
Yeah, I would. I mean, it's good because you don't need to worry because people are there to take care and you are under supervision. And the intensity of work they will be monitoring,
Mhm.
and also if you get any problem they are there to help you.
Yes. Okay. Now, before we go further, I'd like to know more about what kind of work you do. That is okay.
Yeah, sure. I'm a chartered accountant.
Okay. And what does it involve?
Well, sitting on the desk all the time and working on the computer basically.
So this means that you don't have to stand for a long or go to and fro during your work.
No longer standing and very little walking.
So in that case, you can resume your work in about 6 weeks' time.
Okay.
Right? Provided that you can cope with the work demands, both physically and mentally. So it would be a good idea to talk to your employer about this. because you will need their support in modifying your work duties, starting with low level of responsibility and then gradually, going back to your full work duties is suggested.
Okay, yeah, fine.
And there's no hurry, so take it slow. See how your body is responding to it, listen to your body, and then slowly and gradually improve the amount of work.
Yeah, absolutely. I won't rush at all.
Okay. Now, do you have any other concerns apart from what we have just discussed?
Doctor, to be honest, I cannot stop thinking about the risk of future attacks. I really can't. So, is there anything that can help me to prevent future attacks?
Definitely,
Yeah.
definitely. It is absolutely preventable.
Uh-huh.
Okay, and the main reason why people tend to get heart attack is because of the increased cholesterol level.
Okay.
So if we keep your cholesterol levels under check, the chances of getting another heart attack can be reduced.
Okay.
So the first thing you can do to keep your cholesterol under check is to make changes in your diet.
See.
Yeah, it would be really helpful if you try to incorporate more of vegetables in your diet and try to include as much grains, the whole grains as much possible, rather than having products which are made of flours like breads and pastas.
I see.
Basically what happens is when you take more fiber, it reduces cholesterol from your body.
Okay.
Here there are two ways, like either I can give you a standard diet plan which you can follow, or it might also be possible to contact or consult your dietitian for getting a customized diet plan. What would you prefer?
Well, I would prefer to see a dietitian because to get personalized advice.
Yeah, and you can also make changes as per your preferences and taste.
Yes, definitely.
So, your concerns that you explained about feeling weak and tired, let me assure you that it's absolutely normal to have those kind of feelings. And I'm really glad that you came up and discussed this with me.
Yeah.
I hope you are a bit relieved now.
Yes, doctor. Yeah, relieved a lot.
Okay. And before we sum up this discussion, can you summarize what we have just discussed?
Well, I'll be okay after a few days.
Yes, absolutely
Yes,
fine.
Yeah, I need to join this exercise program. I'll also see a dietitian.
Yes, yes.
Yeah,
And make sure that you're taking your medications.
Yes, that's
correct.
Yeah.
Okay. So next, please see my receptionist. They will be helping you with more details on the exercise program.
Sure, without a miss.
Good evening, Ms. Smith.
Good evening, doctor.
So, as per my understanding, we are meeting today to discuss John's recovery after his recent asthma attack. Am I
Yes,
right?
doctor. Yeah.
Okay. So, before we go on, I'd like to ask a couple of questions to see, how he has progressed after the attack. Is that okay?
Sure.
So, after you went home from the clinic, did he have further attack of asthma?
Yeah, he had one yesterday, in fact.
Okay.
And but thankfully it was not as bad as the first one. Yeah.
That's good. Fine. Okay. And how is the inhaler working for him?
He is able to use it, in fact, after using it, the breathing issues were reduced.
Okay,
Yeah.
great. Is he comfortable in using the spacer and inhaler?
Yeah, yeah.
Now, for me to discuss the management, I'd also like to know if anyone in the family, has any allergic condition like asthma or eczema or hay fever.
Well, in family, no one has asthma, and I do get hay fever when the summer is around.
I see.
Yeah.
Okay. And these two attacks he had, the first one and the one he had yesterday, did you notice anything in specific which might have brought it on?
Mm, I'm not sure, but yesterday when he got this bout, he was actually running in the garden.
Oh.
Yeah,
Okay.
so
Okay.
that could be the reason.
Okay, so it is the activity. And did you notice that smoke or things like dust mites could be causing this attack for him?
Well, no one smokes in the house, and we clean the house regularly, so I don't think it can be dust mites.
Right. Okay. How about the atmosphere? Any changes in atmosphere which might be affecting?
Well, yesterday evening, weather was cold. Yeah,
Oh.
it was cold outside. Yeah.
Okay. Okay. Fine. Now, the reason I asked all these things is because, these are actually the things which are responsible for getting asthma.
Oh,
And as a parent, it is very important for you to be aware of these things. So, I'd like to discuss asthma in detail with you, but before that, I'd like to know how much you know about asthma.
well, I don't know anything. I mean, not in detail,
Mhm.
but I would really appreciate if I get some more information about
Yeah,
it.
sure, definitely. I'll explain it to you in detail.
Mhm.
So, basically, asthma is a chronic condition of lungs, and it happens mainly because of allergy.
Oh,
So, what happens is when person whose immune system is very sensitive,
Mhm.
when they come into contact with certain things, their air pipes, the pipes that take the oxygen from the atmosphere into the lungs,
okay.
those tiny tubules become narrow
I see.
because of the allergic reaction.
Okay.
And also sometimes because of excessive secretion of fluids in those tubules,
Mhm.
the pipes become narrow and blocked because of those secretions. As a result, the air cannot flow smoothly from atmosphere into the lungs and out from the lungs.
Okay.
This is called asthma.
Fine.
And the common symptoms are like breathing difficulty because the air cannot pass smoothly, and the wheezing sound because the air
Yeah.
gushes through the narrow pipe, and that causes the wheezing sound. You might have noticed John getting
Yes.
that.
Yeah.
Now, the main reason behind getting asthma can be a family history of allergy.
Mhm.
You mentioned that you have hay fever, so
Yeah.
that could be one reason.
Mhm.
And the other reasons could be the trigger factors like pollens and dust mites and the cold atmosphere
Mhm.
and certain vigorous physical activities which might make it worse.
Yeah.
Now, I know this is a lot to take in. Feel free to voice your concerns if you have.
Yeah, seriously, it's a lot to tackle actually. But after knowing this now, my main concern is about his future. I really can't figure out now how to help him.
Yeah, naturally, being a parent of just a 5-year-old child, I can see where you're coming from.
Yeah.
But don't worry, to be honest, I've seen a lot of parents being able to manage this condition if they kind of educate themselves about the condition. So now, because he has asthma and you know what asthma is,
Yeah.
we will be giving you some strategies and guidelines. And if you follow those strategies, he will be able to, go ahead with his future activities without any problems.
Oh.
Right?
Yeah.
Okay. So now let's move on to discussing the management techniques.
Mhm.
Okay. The first thing is, because asthma is caused by trigger factors, it's important to keep an eye out for things which bring the attack on.
Okay.
It would be helpful if you keep a diary of things which cause allergy for him and the breathing difficulty.
Okay.
Okay, and then please ensure that he stays away from those things.
Sure, I'll be watchful.
Yeah. So if we keep that in mind, we can prevent future attacks, or at least we can, make them less severe, so that he doesn't suffer from, serious complications because of it.
Okay. Sure.
And the second thing is, we will be giving you guidelines which would help you decide whether the attack he has is it mild, moderate, or severe.
Okay.
And if the attack is mild, we will also be giving you suggestions on do's and don'ts, so that you can tackle those things on your own and you don't have to rush to the hospital every time. Do you think you can do that?
You mean to say I need to tackle him, not a doctor or a nurse?
I know, being a layman, it might sound strange.
Yeah.
But as I said, it is a chronic condition, and unfortunately, there are chances that he may be getting frequent attacks. And if the attack is mild, then really there is no need of, healthcare professionals managing it. It can be managed at home as well.
Okay.
Right?
Yeah.
So we'll be giving you a step-by-step process, so that you know exactly what is to be done and how it is to be managed. And with that in place, you know exactly what to do if gets an attack, and he can get immediately, he can get the help. You don't have to wait for someone to come and help him. You will be empowered enough to help him.
Yeah.
Can you do that?
Yeah, that's reassuring. I think I need to be more proactive.
Yes.
Yeah.
And there will be situations now that that you might not be around him, like when he's in the daycare, when he's in the school.
Yeah.
So what I suggest is, you inform the school staff, inform the daycare staff that he has been diagnosed with asthma, and also the guidelines that we will be providing you can share those guidelines with them as well.
Yeah.
So in case if he gets attack at school or at the daycare, those people should also know what is to be done.
Yeah, I mean, I didn't think about it. Thanks for pointing it out.
No, it's my duty,
Yeah.
and in such cases, because the child is very young, they themselves don't know what to do.
Yes.
They might get confused. So if adult, carers are present, they can tackle the condition pretty well.
Yes, right.
Okay, and we will also be giving you suggestion on when it is the time to seek help, because as I said, only mild attacks can be managed at home, but if it gets worse, if it is getting severe, then it's really important for you to rush to the hospital and get immediate help from the medical staff there. So we'll be giving you guidelines on what are the symptoms that you should be watchful of, and when it is the time for you to take him to the hospital rather than waiting at home.
Sure.
Okay. So do you have any other concerns apart from what we have just discussed?
No, I'm okay with it. Thank you.
Okay. So the next step for us will be, first I will be doing a thorough assessment of John to see how is his progress.
Okay.
After that, we will be creating those guidelines. We'll sit together and create it, and I'll explain it to you in detail so that you know the steps to be taken.
Yes.
And finally, we'll also be discussing some support services, like there are some support groups which you can join to educate yourself and to be more confident about managing this condition.
Yes.
Right?
Yeah.
Okay. So we have reached at the end of this consultation, but it would be helpful if you could briefly summarize the steps that you need to take for managing his condition.
Well, you'll be providing me some action plan which I need to consider, which will help me to which trigger factor I should keep an eye on, and if I find anything wrong, initially I need to treat it at home.
Yeah.
And if situation is not under control, even after a few minutes, I need to take him to the hospital.
Yes.
Yeah.
Okay.